Hi, everyone.
Hi.
Nice to see you. My name's Donna Schell. I work for the North of England Commissioning Support Unit, and I'm particularly assigned as a senior consultant on the National Capacity Tracker Programme. And I'm very pleased to be joined by a couple of colleagues, Sasha and Laszlo from Wiltshire Local Authority. Both Sasha and Laszlo work within the brokerage team, and as such are concerned with the finding of suitable placements and solutions for those people with health and social care needs. So welcome both of you. Thank you very much for joining us. I suppose just to kind of kickstart our conversation, really interested in how Wiltshire Local Authority and how your team is using the tool, the National Capacity Tracker, to help you in your everyday work. Just wondering whether, Sasha, perhaps you can kick off by expanding a little bit on your role, responsibilities, and how you see this tool working for you.
Yeah. As you said, I'm a brokerage officer at Wiltshire Council. And my role is to source and establish person-centred, high quality and cost-effective care support packages for vulnerable adults. I manage our discharge to assess referrals, and I work alongside both our internal and external partners to safely discharge patients from both acute and community hospitals. Working in brokerage is a very fast-paced environment with provider capacity changing from one day to the next. Having the capacity tracker part of our brokerage toolkit, well, for one, I use it daily. I find it particularly invaluable, particularly when sourcing out county placements.
Have you used it long then, Sasha? Is this gone back a few years, or is it more recently?
I'd say more recently, within the last 6 months.
Okay.
So yeah, when I started, it wasn't something I was using. But now that I am, I can't imagine not
You're
using
addicted
it.
to it.
Yeah, it's one of the first things I open in the morning when I'm opening up my desktop. I'll get the capacity tracker out.
Okay. Okay.
Yeah.
Well, that's certainly good to hear. And do you think it's changed the way you and your colleagues, and indeed the staff across the kind of Wiltshire Local Authority, have how they work and how they go about their work? Has it changed that for the better?
Yeah, well, I feel it's improved the way we work by having that sort of that insight of real-time bed capacity. It speeds up the process of sourcing for us, and allows us to sort of contact the homes who
Yes.
actually have availability rather than calling homes on a whim.
I see.
We understand at Wiltshire Council how busy our providers are and how overwhelming it can be when sometimes they're contacted, several times a day
Yes.
regarding their bed vacancies. So yeah, to have that tool, yeah.
We often use that as hopefully an incentive to providers, that they will not be burdened with the unnecessary calls, that by putting information out there to provide for the likes of yourselves and your colleagues, hopefully it will reduce that. Do you get that kind of feedback from them? Do they feel as though it's saving their time indirectly?
Yeah, the providers that are using it have said it is definitely reducing the volume of emails and calls
Good.
since using it. It has been all very positive what we've heard. A simple tool to navigate. I think
It's
it's
getting
sometimes
used to it, isn't it? It's getting into that routine.
that's it.
And clearly the value of the information, it relies upon accuracy, it relies upon frequently updated information. That's great. Thank you, Sasha. Laszlo, perhaps we can kind of just pick up a little bit on the kind of impact it's had with those providers. What kind of do you sense? And maybe you could expand upon your role a little bit as well, but what do you sense is the impact that it has on care providers across Wiltshire?
Hello. Yes, thank you. I'm working alongside with Sasha as a brokerage officer, and I believe I've with my job role, I'm using perhaps a bit more the capacity tracker than Sasha. Sasha's using more of the contracted providers, and I often use, we call it spot providers, which we don't have a contract with, an out-of-country provider. It definitely helped a lot, because having to have one page when I can do my checks, my search to see what kind of bed they have available. It's very clever to actually filter it down, so I can know that if I'm desperate, I filter it down for somebody who selected the last week, updated it. And then with that conversation to have with new providers and the details, it's very useful with the email addresses, the different phone numbers for head office as well. And also because I'm dealing a lot with out of country, we have to do all sorts of safety checks before we can place a customer outside of Wiltshire. Therefore, for me to see that this provider is already working with their local authority, it's a very, very useful thing for us.
Yeah, no, that's good. So if I said what's in it for the provider, what do you think they would say if we were asking that question of
the provider will get the phone calls that it can be a more search. Oh, sorry, I'm frozen.
No, I think you're right, because perhaps a little bit more focused conversation.
Yes, that's the very, very focused search we can do. So when they're selecting one kind of bed they have any available, they're not going to have phone calls just because they selected they have one bed available. They can select it if it's a nursing one, is it a dementia bed, is it a residential, and they're not going to have more phone calls, unnecessary phone calls, when it's already up there on a live page.
Yes, certainly it doesn't. I've always found that it doesn't negate the necessity to have phone calls, but it certainly does reduce the likelihood of people being inundated with calls, especially, you're one authority that would be phoning them, and potentially they could be receiving similar calls from a number of authorities who are potentially in different areas. That's really helpful. Thanks, Laszlo. I suppose the question to any of you really, and this is it goes back to the impact that it has on the providers, and we have 2,000 providers across the region, and I'm sure the numbers of providers that you are in contact with across your local authority, but a number of them who are perhaps less engaged with the tracker will talk about the burden of completing it. And because it does take time, it takes time to familiarise yourself with it in the first place, and then to complete it on a regular basis. And some of the information we require it to be daily updated. I'm just interested how you help them, support them, guide them in, and engage with them ultimately in completing it to meet your needs. How do you kind of do that? How do you kind of encourage them to do that? How do you deal with ones that are disengaged?
Well, when I do the searches with filter down and I can see there is a provider perhaps hasn't updated it for some time, and they're advising me that no, we don't have a bed available. I had so many phone calls about it. We can reassure them that obviously we're using the capacity tracker when we find their details, and reassure them that if they update it regularly, they will not having all that unnecessary phone calls, all that unnecessary inquiries, and the small input they put in daily to update, or weekly, because I don't believe they need to update it daily. But if, for example, weekly, if they update the tracker, that could be very viable source for all the brokerage team, but not just in Wiltshire, but all over the country. Yes. It's a very, very useful tool. And everywhere we got the hospital escalations because of the COVID cases. So we are in crisis as a nation for placing people to safe, good care homes. And often we have to go to homes that we haven't used before. And this would be our first point of contact.
Yeah, that is a good way of phrasing it, that is your first point of contact. And therefore you can kind of filter and shortlist the people that are more likely to kind of meet your needs. It's really, really helpful. Thank you. Lastly, I suppose, we we've been around, and the capacity tracker has been around since 2017. You clearly have not been using it since then, but I assume you haven't, but maybe colleagues have, but it's been around since that time. If you had some queries or suggestions or need yourself for support in using it, where do you go to for that, either of you? Where do you seek out that help?
Well, I would definitely go to the website and you can see the what's new, the resource center or the help guide, and they can give you all the necessary information. It's funny you mentioned that some of our colleagues perhaps used it from 2017. We have 2 senior member of staff who used it previously in the past, and just the last few months they started to use it again and their account was blocked. So they contacted this resource center and their query was solved within hours, I believe, and they've been using it ever since.
Okay, that's encouraging. Yes. Yeah, I mean, the resource centre, I think, is we're reviewing it to make it even more user friendly. I think there are kind of things that we can further improve upon that, and welcome people's feedback on the resource centre. The help guides are pretty kind of useful as well. They kind of show that pictorial way of how to do things. So newcomers, new people in your team that are joining you that need to be onboarded onto it, hopefully we can turn that around pretty quickly and really understand what they're using it for, so that we make sure they've got the right access permissions. Yeah, there are various ways that you can seek out support. Our support centre is available to call, so hopefully you have good experiences of that. But thank you both very, very much from Wiltshire brokerage team. Really appreciate your time today, and thank you for sharing your experience.
Thanks, Donna.
Thank you.